Good afternoon, and thank everyone for joining us. Today, we will be discussing Washington University's medical program for performing arts. And I'd like to welcome Dr. Hunt and Dr. Lynnette Khoo-Summers for joining us today. Dr. Hunt, would you like to go ahead and give us a little information about yourself?
Certainly. Thank you so much for having us today. I love talking about the performing arts program. I think my passion began as a dancer myself. So I grew up actually in St. Louis dancing, and went away to college at University of Texas as a dance major. And ended up kinesiology major and going into medicine, but the passion is still there, and the understanding of what dancers put themselves through and what they're asking their bodies to do. So I tried to couple together my love for the arts and medicine, and have been lucky enough to be a part of the medical program for performing arts. And it's a great program here at WashU. It's been around for quite some time, actually. We started way back when Dr. Gilden used to go to the symphony, and he was our symphony doc. So he'd have clinic at the symphony. From there, one of my prior partners, who unfortunately has retired, Dr. Prather, she started kind of revamped the program. And then when I came, and when Dr. Lynnette Khoo-Summers came, who you'll hear from soon, we each kind of revitalized it with our own passions. So now we have a very robust program, and we're excited to tell you about it.
All right, so my name is Lynnette Khoo-Summers, as Crystal and Dr. Hunt mentioned. My background is also mostly in dance, although I did play the piano for several years and the violin. So I did dance in college, and then attempted to be a professional dancer in Chicago, and unfortunately I injured my knee. So then I had to think about what else I wanted to do, and physical therapy was one of those things that when I was going through physical therapy, I said, well, maybe I could do this, and came to WashU and did my physical therapy degree here. And we've ever since then have had interest in performing artists, along with, like Dr. Hunt was saying, our other colleagues, who all have some background in performing arts. And so I teach as well as see patients in our program in physical therapy here at WashU. So I do introduce performing arts interests to some of our students, and they're always looking for ways to learn how to take care of performing artists.
Okay. So what is performing arts medicine?
So performing arts medicine is actually pretty broad, and it is taking care of kind of the artistic athlete and a dancer, and then an individual with a lot of repetitive use as a musician. And we don't always think about them as getting injuries, but because of that repetitive use, they're actually a little bit more prone to injury. And so we take care of dancers, musicians, acrobatics, circus performers, gymnasts too, sometimes fall into this category, vocalists, anybody that, again, is using their bodies as performing artists. So it's a wide range of people, and we get a wide range of diagnoses too.
So I would add on, performing arts medicine would also be, which we'll talk about a little bit more, is to educate the performing artists how to take care of themselves so that they can try and minimize their injuries and think smart about what to do, what not to do as part of what we do. And then it's usually also, that's why we have Dr. Hunt and myself, it's a collaborative approach of treating a performing artist. So it doesn't just take one, it takes a village, like we've always heard, to get them back to where they want to be, which is back on stage, and as quickly as possible, if that's, that's something that's doable.
Yeah, and I would also add that we have a bunch of different types of healthcare providers in our program. So Dr. Khoo-Summers and I are the co-directors, but also Dr. Aaron Chamberlain is a surgeon, a specialist in shoulder and elbow surgery, and he has a background in violin and is part of our program. And then we have a wide variety of other physical therapists and chiropractors, voice specialists around the city that we use as needed.
And tack onto that, not just locally. So if somebody from St. Louis is traveling to, let's say, New York, both Dr. Hunt and I have, other colleagues or references that we can help them take care of their bodies when they're not in St. Louis, or vice versa. A company's coming into town, where should I go? Those kind of things. So it's not just locally, but sometimes nationally and actually sometimes internationally as well.
You mentioned the providers. What would you say are the 4 main initiatives of the Performing Arts program?
You want me to tackle that one?
Sure.
Okay. So yeah, I think that our whole program has 4 focuses. So one is seeing patients in clinic. And we have a performing arts clinic that is specific to performing artists. So during that day, we have a physical therapist, usually Lynnette, and some others from around the city that come to the clinic and see patients together. And it's a great way to see this type of patient because they're very motivated, which is great, but they don't always listen. So it's nice to have both of us there to really be able to give them the information that they need, and really putting the 2 different lenses on and helping patients to understand kind of where they are and where they want to be. So that's our clinic. And then we also have event coverage. And Lynnette can probably tell you a little bit more about that, but Lynnette will oftentimes go to the stage behind the scenes before shows, work on some of the dancers. A lot of the shows that come through town that perform at the Fox and Two Hill and other locations will get in touch with us if they have a performer that needs something, and we'll either see them in clinic or we'll see them behind stage. And then we also do a lot of community outreach. So we love going to the studios and the conservatories and universities and talking to the students in both programs, music, dance, and all, about injury prevention, because it really is kind of one of the most important things and bits of information that help these dancers and musicians to do their thing and continue to do it long term. And then the last part is research. And so we have a bunch of research projects that we have interest in. And we research anything from how dancers' hips work to turnout to kind of knowledge of injuries, lots of different projects going on.
Sure, I'll add to what Dr. Hunt says about event coverage. So yes, I do go backstage before a show usually, and address whatever issues these dancers, mostly dancers, have at that point in time. And then also if I need to, I would either contact Dr. Hunt or say, okay, when you go back home, wherever home would be, you need to go seek further medical care. Yes, you can dance right now, but I would highly advise going to take care of it now versus later. And so that is really fun for me because I get to meet different people from all over the country, but sometimes all over the world too. And I also help them educate that there are, medicine associated with performing artists, and not to be shy and say, oh, I'm not going to a doctor because they're going to tell me to stop what I'm doing. So there's some of us who don't do that unless it's absolutely necessary. So they get familiar who all of us are, not just us two, and be able to get their help like they need to. And then community outreach, like Dr. Hunt says, injury prevention. So education is key, because if they don't understand, like for example, what good pain and bad pain is, okay, good pain, you can tolerate it for a little bit. It's maybe because you worked hard, your muscles are sore. versus bad pain. Okay, well, I'm having sharp shooting pain. Well, you shouldn't continue dancing or performing at that point. You need to take care of it. And the sooner you take care of that, the better the outcome would be in general. So yes, and then we have various projects and research and interests that we would like to look at as well.
Could you tell me about any of your recent projects that that you are excited about currently?
Right. So primarily the hip study is more on Dr. Hunt's realm, but I do see, in our dancer screenings, I do assess how the hip moves, what muscles are working, not working, and then educating that dancer, okay, these are the problems that I see, and maybe you should need to address it. And I would give them brief things to look at and what to do. And if it's severe enough during the screening, I would say, I need you to seek more further medical care. And so that's part of the screening. Other things that we screen for are things like eating disorders that do occur in the dancer population. So if there's a red flag during one of those surveys, then we would have a discussion and say, maybe you, again, need to seek further medical care. You shouldn't wait because there's all hosts of other medical issues that can occur because of an eating disorder. So those are things that we get to look at and then maybe track across time how they've progressed or actually regressed. And then if they do get injured, there's also sort of a baseline that we can go, okay, this is what you were before you got injured, and this is what you look like now. And then you can always encourage the dancer. You can't always go back to the way you were if you keep working on it, unless it's a very severe injury.
Yeah, I would add one of the other projects that we're working on is looking at the kind of knowledge of dancers with their health and wellness, and also from multiple points of view. So kind of knowledge base for the teachers, for parents, for dancers, and then seeing if there are some areas that we can really improve. And that if we gave people more information, more details, then long-term would their health be affected positively. So one of the things that we really want to look at in our dancer population is if they have a relative energy deficit. And if they have a relative energy deficit, meaning that they don't have as many calories in that equals calories out, then you're running into issues with eating disorders and possibility of increasing risk for stress fractures, menstrual irregularities. And we know that, yes, that can cause issues in the short term, but in the long term, it can also cause issues with cardiac disease and osteoporosis long term. So this can sometimes be an opportunity to kind of open the dialogue and look at some of the things that can make patients healthier overall, and not just their knee and not just their hip.
So in addition, I would say that's when we have other colleagues across, either St. Louis or around the world, where we can say, okay, because you think of food one way, maybe it's time to see a dietitian / nutritionist to help you improve the ability of what should I eat, how should I eat, when should I eat, so that it fuels my energy to be able to dance, 8 to 10 hours a day, if that's what is required. Sometimes they're just not knowledgeable about what they can do and what's out there, because there's a lot of information out there. And it doesn't mean that that is the one fit for that one person. So trying to get individualized care would be helpful. And so that's, either Dr. Hunt or myself will say, okay, how about we try going to see so-and-so? And, while we treat your musculoskeletal injury, we need you to also see like a gynecologist for your menstrual cycle problems that you currently have, because you might not get better as fast as you would like if that is not addressed. So we have definitely a whole host of colleagues and references that we can get people to.
One of the things you just hit on that I'd kind of like to kind of come back to is you talked about the 8 to 10 hour practices. And I think talking about that kind of helps put into perspective why it's so important to have the preventative measures in place. Would you mind telling us what is a normal practice like for dancers, for members of an orchestra, for the different types of performing artists?
So I can touch base on that if you'd like. So dancers starting at a very young age, they dance, maybe they start with 4 hours a week. And then when they're more interested in becoming a professional dancer, they can dance, up to, if not higher, 15 to 20 hours a week on top of rehearsals. But then they are kids, they have homework, they have, other things that they're working on. And then collegiate level, same idea. So it depends on, how, whether it's conservatory or university level, will determine how many hours that they actually are in dance. But that does not include rehearsal time, which again can range from 2 hours a week to even 15, 20 hours a week in addition to dance classes. Musicians, for example, the St. Louis Symphony Orchestra, they have certain limitations or guidelines put by the Musicians Union. So that's kind of good. The only problem comes when the musicians themselves go, oh, I need to practice more. So then what happens is, yes, they're already working potentially a 40-hour work week, but then because they, most performing artists are perfectionists, so they think the more I practice, the better I am. So they might tack on another 10 hours a week in addition to the 40 that they're expected to do already. And that's when Dr. Hunt mentioned earlier that repetitive overuse syndrome that would occur in a majority of performing artists.
Yeah, I would say too that when we do our community talks on prevention, we do actually spend a lot of time talking about what our bodies need to do the work that we're asking it to do. Because again, as artistic athletes and repetitive use, being at risk for repetitive use, we really have to pay attention to giving our bodies what it needs to perform. So we kind of talk about the basics, going back to making sure you're hydrated, that you sleep well, that you're eating a good balanced diet. And, sometimes we're surprised at how poorly we all take care of ourselves actually. But even somebody that requires, the use of their bodies to do their trade. So, one example, when dancers especially are getting ready for a show, you'll be, dancing during the day and then going to rehearsals at night. So it could be escalated to 8 to 10 hours of dancing a day. And they're pressed for time. They maybe bring, minimal things to eat, while they're at rehearsals. So you really talk about like what is a good snack and making sure that it's, whole grains and you're not eating something that's just going to go straight through you and you're not going to give you enough energy. And is it clean eating? Does it have a lot of preservatives and all those other things that could make you not perform as optimally? So, I think talking about the basics is really important, and we really do try to give specifics.
So I would add on, people might not know. So for example, the companies that come through our Fox Theater, the musical theater companies, they have usually one day off, which is usually Monday, and they do anywhere between usually 8 to 10 shows a week. So that's a lot of time performing. And unfortunately, a lot of the performers, in particular the dancers, actually don't have time to take the class to get them almost back to reset button of where their body needs to be, because the repetitive nature of dance, it's always the same direction, the same leg, or the same motion repeated over and over again. So most people don't realize, oh, wow, you're dancing so much. So that's another thing of education component. You need to find time. Yes, I know you're tired, but maybe we need to do something basic like, okay, just lie down and maybe work on your abdominal muscles just to support your back for all the hours that you're going to be on stage, you know, jumping and turning and lifting and those kind of things. So that does also affect the dancers in the professional setting.
Yeah, a great example of that is we took care of a dancer from The Lion King, and he'd been in the show for 10 years, you know, doing the same exact role for 10 years. So he would jump across the stage in one direction, and his left calf was 3 times bigger than his right. And we actually saw him for a calf tear. So he was just kind of, you know, overusing that side, and it ended up tearing. So I think that's a great example of that, of making sure that you're balancing out your body for what you're doing and asking it to do all day.
I know we've talked a lot about dancers, but also musicians. And I know that you guys go in and give in services for the St. Louis Orchestra. And Lynnette, do you mind touching on, like, kind of pointing out the fact that these musicians hold a position or an instrument for hours at a time? Can you elaborate on that?
Sure. So a good example would be, I'm talking to one of my patients and they're like, oh, what do you normally do? And I said, oh yeah, I love to treat performing artists, dancers and musicians. And then the first thing out of that patient's mouth is, musicians get injured? Really? Why would they get injured? And so a lot of the community don't realize that musicians, Dr. Hunt can also speak to it, up to 80% of musicians have some sort of musculoskeletal injury in the span of a year. So it is prevalent because they're always either sitting all day or standing all day. They cannot change the position. They can't change, for example, you know, an example would be a violinist, because everybody knows that what a violin is. So they're always holding in their left arm and they're moving their right arm. Well, you never see somebody doing the opposite when they're at rest, because you really can't play that way. So those would be the times where you're seated constantly. It's always the same thing. So for example, out in the, you know, other population, if you sit at a desk all day, you're going to potentially get neck or back pain, right? So it's the same thing with musicians. Then they can't change positions at all for that musical instrument, but they're also, you know, I would say stuck on stage in a specific position where they cannot make sometimes modifications that they need to help with supporting their body a little bit better.
And Lynnette is the guru of that. So she is fantastic in really pinpointing where those issues are, like where that repetitive stress is, you know, how they're holding their head and how they're holding their shoulders and arms, and giving them instructions on how to basically undo that. So you've got to basically stretch out the muscle that's been, you know, taut for 8 hours. You need to make sure it gets balanced from side to side, front to back, and all. So she spends a lot of time looking at the patient while they're playing. And we actually, when we're together, when I see any patient that is a musician, we ask them to bring their instrument. It's really informative for us to see how they're holding it. And that's part of what we ask them to do too, is to play in front of a mirror. As for the patient themselves, it's really informative. And so we try to really tease out what part of the system is dysfunctioning and where we need to kind of biomechanically make it right.
So I'm going to tack on to, yes, Lynnette watches people and how they move, to the extreme where if Lynnette is at the symphony, and depending on where she sits, I might, if I'm sitting up higher, I actually might bring my binoculars and actually watch intently how some of the musicians, if they're my current patients, how they're sitting or how they're changing their positions or what are they doing at a break. And then when they come back to see me, I'd be like, no, that's what you were doing while you're on stage. And they're like, oh, I did not know that. So making them aware, or just any patient aware of the habits that they have that is causing one of the pain problems, is definitely beneficial. But I've done that before.
What other community programs are you involved in? And I'm going to say COCA as an example. You guys are involved in that. And why is it so important for for you guys to be in such a program like that?
The last 10 years or more since I've been here, we've worked with COCA, and in the last few years, it's a little bit more formal relationship. So we are there in kind of a training room type of an arrangement where we're at COCA and patients, and I should call them dancers, can come and see us for any of their issues. And sometimes it's a new issue that they just have a question about. Sometimes it's a patient that we're following and we just want to check in on them. It can just be for advice. And it's a great opportunity, I think, for us to be able to be there as soon as possible for an injury, because we all know that if we can address it, even before it happens, which is where the prevention really comes in, but as it is happening, then we have a much better chance to make sure that this resolves and doesn't turn into a long-term issue. So we really enjoyed that partnership. We've worked with educators, their teachers and instructors there, to make sure that the information gets passed along through to students and all on injury prevention and kind of the overall health and wellness.
So not only when you say the dancers at COCA, it's not just the students. So we've also seen some of the teachers when they either have a question, how should I address, their own pains, because they use their body all day teaching as well. So we've done, basically anyone who is within COCA, we are happy to, to have to take a look at them and always say, okay, this you can do X, Y, and Z, but if it seems to not get better, you can stop by and see one of us or go see your own physician at that point. But, trying to encourage them to try and take care of things sooner than later.
And around town, we also work, of course, with Washington University Performing Arts Department, Webster University, Lindenwood, Missouri Baptist, most of the universities around. We've been part of either their education or for treatment of their students. And then at the studio level, we see a lot of studio kids around town, and then also Webster Conservatory. So it's been fun to be involved in the community with all these great performers.
So I would tack on Circus Harmony too. So
yes, we get to hang out with the Circus kids.
Harmony is
I'm sure I'm missing somebody, but it's lots of fun.
It's a kid-run circus, and so right now, unfortunately, you can't go to the City Museum, but they're located there, and they have performances all weekend, and the kids get to perform and have fun while learning a skill that they can carry and progress. If they want to be a professional circus artist, there are ways to go about doing that in different parts of the country and different parts of the world.
What do you enjoy most about taking care of performing artists?
I think it's multiple things. I think I mentioned earlier, I love how motivated these patients are. I mean, and how well they know themselves and their bodies. It's a great combination of being able to then give them information about what I see from my perspective, and then putting together on how they can make some changes or even just little tweaks. Dancers are so good at visualizing and understanding where the movement should come from, how it should feel. And that's great, because unfortunately some people don't have that that kind of kinesthetic sense, and so we don't have to start there. They're already there, so that's wonderful. And certainly I just love being able to help people in general to be able to pursue their passion, but this is also a paycheck that they sometimes have to pursue, so there's a little bit more weight to it, and sometimes so yeah, it's definitely a really fun patient population.
So for me, I would say just almost like the education piece of opening their eyes and saying, okay, you can do this or you can't do that, and then helping them through this whole process of getting them from point A to point B. Yes, neither Dr. Hunt and I can fix everyone. We try really hard. And then we also provide things like, okay, I mean, I've talked to professional dancers and their injury is probably fairly severe, now they have to go, what do I do next? So, helping them say, okay, look into these resources or something. So I really like the education piece, whether they're my patient or they're just, a performing artist in town, just awareness. They also like that, we do care, really, we do care, but they also like the fact that we care about them and we can help them get to where they want to be at without being told, unless absolutely necessary, that you can't do what you love to do anymore. So sometimes you don't get that piece from, other ways. And so that, I think I like that part as well. So education, making them go, light bulb goes off, oh, I have to do this or do that, and make me as healthy as possible.
Thinking from like either a performing artist or a parent whose child is a performing artist, why should they choose WashU and this medical performing arts program?
So I'll start and I'll let Dr. Hunt continue. So like she says, we have a collaborative approach. So if we say, okay, I can't do certain things, we have resources. So it's not just the two of us. We have a multitude of people around town, whether it's a speech therapist or a surgeon if they need to have surgery. We do care. We understand where they're coming from, as and whether it's a dancer or musician or circus artist, we understand where they're coming from. We're not going to say you can't do this. We will always say, how about we modify something and then slowly get you back to where you want to be, as we've said so far. And Dr. Hunt and I have a great communication between the two of us. And then, yes, with the rest of the community, for example, a specific chiropractor that we work with, we do communicate amongst each other so that the patient, whether it's the child who's a performing artist or an adult professional, they get a collaborative approach, a full on board approach by multiple people. And so it's not just us, it is everybody trying to get them to what they want to do.
And I would add that we have a bit of a greater understanding of what the musician and the dancer is asking their bodies to do. So we can evaluate it and know kind of the next step and literally the next step. You can ask him to do a passe and to look and see exactly what it looks like when they're in plie and releve, and understand what it should look like and what their bodies should be doing. So I think that's really, really helpful. And also for the musician, I didn't pursue music as long as I did dance, but I did play the stand-up bass for a while and piano and other things. So I understand that part of it too. And I can put that together with my knowledge of musculoskeletal health and biomechanics. So I think being able to talk the talk and know what the patient is really asking their bodies to do is a great perspective.
As a potential patient, what is the best way to get in to see either one of you or one of the other team members in this program?
So we have a secret line. So there's a number. It's 314-747-ARTS, ARTS, and that's kind of a very helpful number to get in to see me. And then I can refer to Lynnette or whoever within the performing arts world is the right fit. Most of the time, it would be required that a patient have a physical therapy prescription to see Lynnette, so I can always facilitate that. But again, when we're at COCA and we're at other places, we're open to advice to, we see a lot of patients from St. Louis Ballet and Big Muddy and lots of other professional groups around town. And so if it's just advice that they need, we'd be happy to supply that as well. Lynnette, do you have anything to add?
So for me, to get a hold of me and get a patient appointment in the state of Missouri, you need a physician's prescription for physical therapy. So that's a law. So yes, most of the time, my patients do come from Dr. Hunt, but occasionally they'll come from, let's say, a pediatrician or something like that. And then they would call our clinic number, which is 314-286-1940, and ask that, I'm a performing artist. I'd like to get scheduled with Lynnette, and they'll try and facilitate that role. Back to just a side note, so Dr. Hunt and I work together. So for example, if I get somebody from a pediatrician and they just said shoulder pain and the patient's not getting it better, then I would have that discussion about, okay, your shoulder's not getting it better. I think you need, a further evaluation. I would like for you to see Dr. Hunt or, another colleague or something. Then I would try and facilitate that process to get them in as fast as possible, because again, waiting to take care of an injury, especially, performing artists, is not good in the big scheme of things. So trying to get them in as fast as possible, seeking the right person to take care of that.
And I see patients at multiple locations around town. So it's not always convenient to come down to the medical center, but we are there at the Center for Advanced Medicine. And then I'm also at the CSCC, which is a children's specialty clinic off of Mason and 64. And then also at Barnes West County, the new facility. So hopefully it's something available and convenient for patients.
Is there any last comments or anything you'd like to add?
I just like to say that I feel honored to be able to take care of such amazing people, and I think that I do get to help people, but I also benefit from being able to see patients in this subspecialty, because again, it is a passion of mine to keep people moving and doing their thing, and so I really enjoy the program that we have.
I would say same thing, and to incorporate, different people in this care is always fun, because then I get to meet other people around town or around the country, and then also the dancers that come into town, but within our lovely St. Louis community, just their backgrounds, where they're from, and what do they actually love to do. I just love to dance for right now, but I would like to become something like, I would like to become a physical therapist, or someday I would like to be a physician. And so sometimes Dr. Hunt and I do provide some of our background and how we came about being in the medical profession, because there are lots of performing artists, when they figure out, okay, this is not what I can do, what other resources do I have? If I want to still see, the performing artist, I can become a physical therapist or a physician or a speech pathologist or something like that. So we also do provide that sort of, not really guidance, but in the direction that they would like to get to. Again, because we have a big community, even though it's small in the one sense, but we have a big group of performing artists and medical team everywhere, who are passionate about, like us, about what we do.
Great. I would like to thank everyone for watching today's discussion, and thank you, Dr. Hunt, and thank you, Lynnette, for joining us, and goodbye.
Thank you. Bye.